Minister of Health, the Honourable Christopher Tufton, speaks about achievements under his ministry. Welcome, I'm Ian Boyne. Minister, how would you sketch the major achievements of 2016?
Well, firstly, I think that we have been able to galvanize support around some critical areas that affect public health. The fight against the Zika virus, for example, is one such, coming on the heels, having formed the government, of the chikungunya issue, which generated a lot of controversy. We took the position that the key to fighting this vector, this battle, was publicly informing the population about their role, engaging greater awareness, visitation to homes, basically mobilizing the country. While we were doing that as part of the preventative measures for people to take action, we were also trying to equip our facilities to deal with those who are infected. And so in terms of the lab, to get a turnaround of blood results, in terms of putting in additional facilities for persons who were severely affected. We, I think, are at a place where Jamaicans are much more sensitive to maintaining control over their own environment as it relates to vector-borne diseases. It's going to be a continuous process, but I think we're better off for what we have been able to do through national mobilization. And as a consequence, I'd cite that as a very positive thing going forward. The other areas, as you know, public health is underfunded, and that has been always the case. We have identified some areas of priority that impact people, and in particular, waiting time related issues.
Major issues.
There are 4 or 5 areas that have been major challenges for Jamaicans who have to wait when they can't afford to pay private providers. So, for example, the surgery. We have hundreds of Jamaicans who are on a long waiting list. We have started the process of extending operating theatre time for routine surgeries, starting with the University Hospital of the West Indies. They have moved their times from 4:30 to 10, and in that time that they've started, they have reduced, I think, almost to zero the waiting time for those who are programmed for university operation. In fact, they are now taking referrals from other hospitals. And the experience, as I understand it, and even speaking to some of the patients, is that it's a lot more work for them, but it's quite rewarding that they have been able to reduce the time for persons waiting for surgery. In some instances, life-saving surgeries. It has put a strain on the system in that we have to get more infrastructure, more personnel, critical care nurses, and so on. But we have been able to manage, and it's a work in progress. Over the next year, we're hoping to expand that process in other hospitals. It does require some upgrading of some of the operating theatre, some coordination of the logistics with the blood bank and so on. But we believe we can add another 3 or 4 in the next few months, and then over time roll it out across. That would effectively reduce waiting, and our target is to reduce by at least a half, by 50%. The wait for certain routine procedures, hemorrhoids, fibroids, and so on. Another big area of wait that we have been able to champion with reductions is in the area of waiting for drugs. Now, as you know, the NHF is effectively the government's health insurance scheme that provides free drugs for those who can't afford it. What we have been able to do is roll out a pilot in 2 parishes, in Clarendon, Maypen, and right here in the corporate area in and around Crossroads, where we have outsourced the distribution of free drugs through private to private pharmacies. 4 pharmacies in Clarendon in and around Maypen Hospital and 8 pharmacies in the Crossroads area is demonstrating that increasingly patients are going to these private pharmacies, getting the drugs and eliminating wait. And the plan is, come April, to roll out in about 100 or so pharmacies across the country. We believe what that will do is literally eliminate the need to wait for drugs after a patient has been diagnosed and a prescription given to them. And we think it's a great way to go. It's a public-private partnership, and that is something that this government has been committed to. How do we engage the private sector as part of the service provision, and in this case, in healthcare? We have addressed waiting time also, and I think successfully so, in the area of accident and emergency.
Yes.
We took 7 hospitals We identified 7 clinics that were closest to those hospitals, in some instances on the compound. We extended the opening hours of each of those clinics from 4:30, in some instances to 10, in some instances to 8. We added personnel, added equipment based on our assessment of what those clinics would need to do. And then we improved the customer service window in the hospitals at the accident and emergency. So within 5-10 minutes of entering, a patient would be heard, not necessarily from a doctor, but at least the initial information would be collected. Then they would be channeled to a triage process where a doctor or nurse would assess their condition. If their condition is deemed not to be an emergency, and 30 to 40% of the times it's not, but the patient would not know that, they are redirected to an extended hour operating clinic, the particular designated clinic. And what we have found is that the numbers serviced by the clinics are going up naturally because more people have access, and it's quicker access because of the extended hours. And the quality of the service in the hospital, not just from a time waiting perspective, but from the time the doctor can now spend with the patient, longer time to appropriately assess the patient, has improved. And the response so far has been quite positive. April, we intend to expand that beyond the 7, and hopefully ultimately it becomes a critical part of the overall arrangement. The other component of weight is diagnostics. And the plan there, we are now finalizing a policy that is going to streamline our approach to procuring diagnostics, meaning equipment, in a more uniformed way, but also looking for private sector partners that would allow us to outsource some of the diagnostic services in a more uniform way. So those are the 4 critical areas of weight that we think have been important to Jamaicans, and we have spent some time trying to address those over the last 11 months.
Thank you very much, Minister. Minister of Health, the Honorable Christopher Tufton, talking to us about achievements under his ministry.